I'm just going to put your information into the computer here. So just your age and your weight is set. Okay, I'm going to find your pathology. I'm just going to set your treatment up, James. So we're going to go half your body weight minus 20 to start with. We're going to keep you on 25 minutes. We're going to oscillate the treatment. I'm going to oscillate using £10. And we're going to set it at 10 degrees because your problem is at L5S1. So this is an infrared heat pad.
Right.
I'm going to put this around your back.
Yep.
And strap it around the front. We're going to leave this on for about 10 to 15 minutes. This is going to heat your tissues up,
right,
which will make your back much more flexible and
yep,
pliable for the IDD treatment. Okay, so if you turn yourself around, okay, you wrap that around the front there and overlap. That's great. Okay, if you now turn around to me, there's a switch here, we can switch it on.
Yep.
We'll turn it to full heat. Okay, if it becomes uncomfortable, you
Yep,
just turn it down.
Okay, brilliant. Thank
Okay, if you have a seat.
you. Yeah, thanks.
Okay, James, there's two harnesses.
Right.
This is the pelvis harness. This
Yep,
is going to wrap around your pelvis and your waist area.
Yep.
And then there's a chest harness we're going to put on afterwards. Okay, so
Okay.
let's put the pelvic harness
Right,
on
yep,
first. So if you just come towards me, okay, I'm just going to find a landmark. So if you just place your fingers there for me, that's perfect. Okay, if you now place your fingers on the harness over the top there, that's lovely, and hold that in place for me, great. If you now turn yourself around, so I won't do the harness up too tight at this stage. Just get it into position first of all.
Yep.
And then once it's in position, we'll get you on the machine and do the final adjustments at the end.
Okay.
Okay, so you can just let your fingers go now, that's great. Okay, if you just take your feet slightly apart for me there, that's great as well. I'm just going to attach these two straps
Yep.
underneath you there like that. Just checking it's all in the right position. That's great. If you stay there for me for a second. I'm just placing the chest harness over you now. Okay, that's great. If I pass these round to you, that one there and that one there, if you just overlap them and attach the Velcro. Good. Okay, let's have a look at you. Okay, good. You're ready to go. Let's get you on the machine.
Okay.
Okay, James, if you take a walk over there,
Yes.
just climb onto the step there. That's great. Good stuff. Okay, and then just want you to lean back into the machine there. Perfect. I'm going to place this pillow behind
Right.
you on
Yep.
there. That's
Yep.
great. Okay.
Yep.
Right, so what's going to happen now, I'm going to press this button over here,
Yep.
and the machine is going to tilt,
Yep.
and you're going to be laying flat.
Yes.
Okay, so. Okay.
Yes.
It's nice and slow, it'll just lay you down to a horizontal position. Okay, that's great. Is that okay?
Yes, fine.
Perfect. Okay, James. Just check the level. Yeah, you're in the right place, which is great. Just bend your knees up for me there. That's perfect. Okay. Just going to place this cord out the way there.
Right.
Right, so we'll undo this first and then we'll redo it up
Okay.
again. So first of all, your pelvic harness just needs to be done nice and tightly there. Okay, there again. That's great. Okay, not too tight?
That's fine.
Feels okay?
Yeah.
Good. Okay, and then we'll just throw those straps out the way. Okay, so this is going to be the tight bit. Pull this across here. Perfect. Okay, just like you to take a deep breath in for me and breathe all the way out. That's great. Okay, good, not too tight.
That's fine.
That's good. Okay, just keeping your legs there for the moment.
Yep.
Okay, I'm going to place this under your knees. That's good. And just have your knees resting either side there. Good. Pull this through. And the pelvis harness is being attached
Right.
to this here.
Yes.
Good. Making sure it's straight. Okay, I'm going to pump up the cushion in the small of your back.
Right.
This is going to lift your pelvis slightly.
Okay.
That's great. I'm now going to come to the top end and I'm going to secure these harnesses behind you.
Right.
Okay, James, I'm going to pull these straps slightly tighter now. You're going to just feel this tug on them.
Yep.
I'm going to secure these into this clip. That's great. Okay. Right, if you can just lift your left arm up for me now. Good. These help to keep you in position while the machine's distracting.
Right.
Just place your arm down there, that's great. If they're too tight, just let me know.
Okay.
And this one here. Good, is that feel okay?
Yes, fine, thanks.
Good, and I'm just going to put some bolsters under your feet now, just to keep your feet up. So that's lovely, good, and then the other one. Perfect. Good. I'm just going to double check everything is correct. Okay, James, this is the safety feature. It's
Right.
a button that you can press that
Yep.
stops the machine at any point. So if you're uncomfortable,
Yep.
you feel the need to cough or to sneeze,
Yep.
just press the button, the tension will release and the treatment will stop.
Okay.
Okay, I'm going to give you this, just place that there. Okay, if you're ready, we're going to start the machine now.
Okay, yep.
Treatment will begin.
Great.
Okay, what you're going to feel is a very gradual increase in the tension being applied through this belt
Yep.
onto your pelvic harness. So you'll feel a very gentle stretch around the sort of waist area. Okay, it will build up to a certain amount. Once it gets to that amount, it will stay there, and it will then drop down slightly, and then that process will repeat
Right.
over the next 25 minutes.
Yeah.
Okay, I'm going to be with you here.
Yep.
If there's anything you want to ask me, or if you're uncomfortable, just say.
Yeah. Okay, thank you.
Okay, James, the high tension has reached its maximum now, and it's just going to oscillate very slightly between 58 pounds and about 50 pounds. And we'll see on the screen here that the target tension is the actual tension. Okay, James, how does that feel?
Yeah, it feels comfortable.
Good, okay. What I'm now going to do is I'm going to release the bottom half of the bed.
Okay.
This will give you a nicer stretch through your lower back as the bed comes slightly apart.
Yeah.
Okay. Okay, you shouldn't feel anything at that point. As the high tension re-engages and the stretch pulls again, you'll just feel the bed part by probably an inch or two.
Right.
Okay. Again, if it's uncomfortable, let me know.
Okay.
But it should increase the stretch nicely. Getting close. Okay, James, the treatment's about to come to an end, so the machine's going to buzz at me and I'm going to turn it off. Okay, good. How was that?
Yes, great.
Comfortable?
Yes.
Did it hurt at all?
No.
Good. Okay, did you feel a slight stretching sensation in your lower back?
Yes.
Brilliant, that's great. Okay, so I'm just going to unclip you here.
Yep.
Just going to secure the bed. First thing I'm going to do is release these into get undone, isn't it? Tight straps. Perfect. Okay, that's a bit of relief, isn't it?
Yeah.
I'm going to remove these bolsters from underneath your
Yep.
feet here. And then these bolsters from here as well. Okay, that's good. Right, and then the last bit is the wedge under your knees there. This is the bit that can be a little bit uncomfortable, so I'm just going to lift one leg at a time for you. So we'll bring this leg up there, good, and this leg here, and we'll slide this out. Okay, James, let's just bring your legs down. Okay, you'll feel the plate there under your feet.
Yes.
Okay. What I'm now going to do is I'm going to bring the bed back from this position up to vertical.
Okay.
Okay. We find that's a lot more comfortable than asking you to sit up
Yep.
and roll off effectively. Okay, so it's nice and slow. Good, does that feel okay?
Yes, fine.
Nearly there. Once the bed comes to a stop, okay, I'm going to grab the pillow, allow the harnesses to fall to the floor. Don't worry about trying to grab those or pick those up, okay, and you can disembark the machine. So I'll grab the pillow, okay, and up you come there, perfect. Okay, don't you feel okay? Not too sore? No, fine, brilliant. Okay, James, this is a nice pack. I'm just going to place it into this. And we're going to wrap this around your back. So if you just lift the back of your t-shirt up there, that's it, good, and just bring it around to the front there.
Yeah.
Okay, that should just take any sort of irritation away. Just keep it for about 10 minutes, and then we're done.
Okay.